Hello, everybody. Dr. David Hartwig here with Atlas Health and Wellness. I'm a doctor of physical therapy, and I've been in clinical practice for about 12 years. I started Atlas Health and Wellness in July of 2022, and I'm here serving the Stewart community, help prevent injuries from occurring, as well as treating musculoskeletal injuries that are not surgical in nature. We don't accept insurance here because, unfortunately, the insurance system does not it's not forward thinking in a sense that these things can be prevented. And I've been doing a series on different sports and things like that. Today, we're going to be discussing common injuries associated with baseball. Baseball is a very asymmetrical sport in terms of swinging and pitching and things like that. And so these asymmetries can result in significant amount of injuries. If you have questions for us, you can reach out to us at info@atlashealthandwellness.com or make your wellness appointment. Our wellness appointments are 100% free. And that phone number is 954-932-8527. So without further ado, let's get into it. So 10 most common baseball injuries. Unfortunately, baseball is a sport that features its fair share of injuries, especially at the pro level. That's also true of minor league level and even Pee Wee level, like, high school. Many, because of the nature of the game and how many games there are in a season, especially with younger people, many of them play club sports and they also play at school, and coaches don't always communicate, which is unfortunate because this can be detrimental to a young pitcher's career, specifically pitching in general. The pitch count matters as you're a young person, and I'm going on a tangent here, so my apologies. But when you are still growing, when young men are still growing and they still grow up into the age of 23, the growth plates are still open, meaning the bones are capable of being moved, and the torsional rotation of the humerus in the pitching or throwing motion can cause alterations in the actual bone structure. And this can influence how we perceive whether a shoulder is healthy or not. And we measure this with the concept of internal rotation deficits. It's called GERD. But without further ado, I don't want to get sidetracked too much. Let's see what the most common injuries are in order. Oblique strain. So as I mentioned previously, the asymmetrical motion of pitching and the asymmetrical motion of batting can cause spasms in the obliques, and with that torsional twisting motion. This is something that can be easily remedied if you know how to maintain symmetry in left and right in terms of flexibility and strength. Most people don't know how asymmetrical they are. I worked up in Illinois, and I had the pleasure of working with a institution that focused mainly on young pitchers and batters. And when I did their evaluations, the number of injuries to the elbow and forearm and just gross asymmetries was insane. So these are very preventable problems. And if you get in front of it, it will actually help improve your game when you play baseball, whether you're pitching or you're batting. So let's see what else it says. Tendonitis. Most commonly, baseball players get tendonitis around the area of the elbow or rotator cuff. This is very true. Usually there is the torsional motion of pitching will stress the ulnar collateral ligament or the medial collateral ligament of the elbow, and it leads to the stretching out of that. That can also cause impingement in the olecranon, and it can cause bone chips to be broken off if your forearm musculature is overly stressed. Now, I know this is talking about tendonitis. Tendonitis precedes what I'm discussing, but it is relevant to the discussion. Shoulder injuries, the rotator cuff in particular, there's usually an imbalance in terms of an internal rotation to external rotation ratio. So if you are a baseball player and you don't know what your internal external rotation strength ratios are, you need to schedule an evaluation with us here at Atlas Health and Wellness today, because we can help you throw the ball faster, harder, and more accurately. Well, your pitching coach can help you with the more accurate end of things, but we can add power to your pitch. And we use awesome technology to measure these things. We use strength testing dynamometry software that can help pinpoint exactly force production in each of your muscle groups. And often an issue with pitchers in general is scapular instability. especially if you are doing a full game and your pitch count, you're towards the end of your pitch count, and your scapular stabilizers are failing, you will develop injuries in the shoulder, elbow, and wrist. All right, what else we see here? Okay, torn labrum. So the labral tear is very common in pitchers, especially because of the throwing motion itself. And the problem is typically a weakness in the eccentric aspect of the external rotators of the rotator cuff on the throwing side. What happens is when you wind up and you throw forward, your external rotators are actually going to slow down the arm as you come across. And if you are weak at all in the external rotation department, you really need to be able to identify how weak you are and to ameliorate this, especially when you're not in season, because this is something that can make you a better pitcher, make you a faster pitcher, and probably a more accurate pitcher. But basically what happens is this internal or this external to internal rotational motion causes the humerus to, if you look at the glenoid, it rolls up on it and it can fray the upper portions of the labrum and cause what we call a slap tear. So let's see what it says. Labrum is a ring of cartilage in the left shoulder or in the shoulder that can be damaged during extremes of throwing. Since pitches repeat the motion over and over throughout the game, they are likely to tear the labrum. Many times surgery is necessary to recover, and recovery time is lengthy. So again, these are things that are preventable, guys. If you are a baseball player, minor league, if you're in high school and you have aspirations to make it to the big league, you need to schedule an evaluation with us. I can't stress that enough, because we can empower you with information that only the Major League Baseball teams are getting access to. UCL, or ulnar collateral ligament injuries. As mentioned before, there's the MCL ligament of the elbow as well. The ligament is inside of the elbow, so it's here. So that stress of throwing, stress is right here, especially after repeated forceful throws. When it's severely damaged, it requires what's called the Tommy John's surgery. And basically it was developed in 1974. And was named after a famous baseball player. And some institutions are actually doing this preemptively to help strengthen the elbow. But in some cases, some people are more ligamentously lax than others, and it may be justifiable. However, if you know how to strengthen the forearm musculature, your muscles should be able to protect your elbow joint. And again, we need to take a look at how the elbow is moving. I have seen some really fascinating injuries to the elbow. And not only does it stress the UCL, but it can also cause bone chips in the olecranon back here because of the instability of the shoulder and the force of the internal-external rotation and deceleration aspect. All right, dead arm, basically that's when your scapular stabilizers have gone kaput or there is inflammation in the joint and the muscles are being inhibited to fire. It's kind of like having a rock in your shoe. Your brain will just shut down certain things if there is an injury. Ankle sprains, okay, this is one that, if you're playing pickle between base 1 and base 2, like that can happen. Also hitting the bag. Some of these circumstances are unavoidable and they are accidental. And so knowing how to stabilize the ankle and make sure that your anterior talofibular ligament is as stable as it could be is very important if you want to try to avoid these things. Next one on the list is rotator cuff injuries, and we kind of already covered that one in the, the torn labrum, tendonitis. So tendonitis develops into what is a rotator cuff injury. And as stated above, the rotator cuff can be a source of tendonitis in baseball players, but also other injuries can affect the arm, blah, blah, blah. Hey, physical therapy may be able to treat them. Not only will they be able to treat them when they happen, but we can help prevent them, okay? But insurance doesn't pay for that. I understand it's frustrating, but if you care about your sports and you care about being number one on the field and maybe getting picked up on a major league level, you need to schedule an evaluation with us. Our phone number is 954-932-8527. All right, wrist sprains and breaks. This usually happens typically with batting. It can happen when you slide into bases. Sometimes these injuries are unpreventable or unavoidable if you are sliding into, yes, I'm still here. Stay on the call. Sorry, running a little late here. Almost done here. Wrist sprains, breaks. blah, blah, blah. Wrist can be broken in catastrophic players season, especially if they're a hitter. However, sprains are a bit more manageable. Okay, torn ACLs. So a lot of folks injure themselves when they're playing sports. The lower body in baseball is so critical. Your hip abduction strength, your hamstring strength, and things like that really help protect your knees. Okay, and these percentages are measurable with good technology, which we have. We should, for example, gluteus medius should be 36% of your body weight or above. External rotation should be 20% up above your body weight. And so these are things that we can measure and ensure that when you're going to play competitively, that you are going to perform better and safer than everybody else around you. So a lot of the strength and power that comes from baseball comes from the lower body. And if you don't know how strong your lower body is or where it should be, you need to schedule an evaluation with us today. Concussions and head injuries. This one, we do treat post-concussion syndrome, but obviously these are things that aren't necessarily preventable. So we're going to kind of skip over that. Typically, if you're post-concussion syndrome, I would refer you out to a insurance-based physical therapy because, again, we focus here on prevention more than we do treating the problems after they occur. Meniscus tears, this also goes hand in hand with what I was talking about regarding the strength of the lower quarter and making sure that your percentages are where they need to be in relationship to your body weight. Bone bruises. What is this one? I guess like when you run into people, batting pitchers. Yeah, I would say bone bruises are usually from like contact injury. Achilles tendonitis, this is something to do with the lower leg compartment and is very easily identifiable on exam. If you have tight posterior compartment, meaning your dorsiflexion is impaired, dorsiflexion should be between 15 and 20 degrees, according to the American Orthopedic Association. So if you don't know what your dorsiflexion is and you want to help, really be able to fire off from start and make sure that you're not going to pop something off or develop something that's going to slow you down when you're playing, you got to come see us. Hamstrings injuries are the same way. Most of the time, there's a quadriceps to hamstring ratio issue, meaning that the quadriceps are usually overpowerful and the hamstrings are underpowered. Especially with young men that are growing, hamstring tightness is often an issue, and it will impair your ability to push off and get that extra little bit of speed that you need to get to that base and slide in safely. My name is Dr. David Hartwig. I'm a doctor of physical therapy, owner of Atlas Health and Wellness. Give us a call today, 954-932-8527. If you're competitive about your baseball and you want to be the best, give us a call today.